بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is a short talk about neonatal renal abdominal masses. The differential diagnosis of neonatal renal abdominal masses accounts about 50% of abdominal masses in neonates, and the most common renal mass in the neonate is hydronephrosis, and it is seen on ultrasound and can diagnosed very easily on ultrasound by multiple cysts of the same size, almost of the same size, which communicate with each other. The second most common renal mass in the neonate is multicystic dysplastic kidney, which is also can be diagnosed on ultrasound and appear multiple cysts of variable sizes, which are not communicate with each other. And the third most common solid renal mass in the neonate is mesoblastic nephroma, which is unilateral, and also other differential diagnoses include autosomal recessive polycystic disease, polycystic renal disease also can be diagnosed on ultrasound, and lastly, renal vein thrombosis, and usually unilateral present with unilateral renal mass without venous flow and Doppler ultrasound. Hydronephrosis, as we said, it is the most common neonatal mass renal mass, and these are multiple cysts which communicate with each other. And here we have the antenatal ultrasound, and we see antenatal hydronephrosis in 32 weeks with bilateral hydronephrosis, and the posterior and the renal pelvis is about 10 millimeter bilaterally. Here, this is the grading system of the ultrasound of the hydronephrosis according to the fetal urology. Hydronephrosis is a grading system. This is a grade 1, and it is uh, demonstrate dilatation of the renal pelvis only, and this is a grade 2 dilatation of the renal pelvis with some calcium dilatation, and this is a grade 3 dilatation of the renal pelvis, as we see here, with uniform dilatation of the calyces, and these are connected to each other, and this is the grade 4, and it is uniform dilatation of the pelvis and calyces associated with thinning of the cortex. Here, this is a grade 1 displaying of the renal sinus echoes, and here this is a grade 2, grade 3, and grade 4 with cortical loss. Here, this is patient with uretropelvic obstruction with hydronephrosis, as we see here, dilatation of the renal pelvis, and this is the dilatation of the calyceal system and some of the calyceal system, and this is the also the nuclear medicine MAG3 with Lasix with delayed excretion of the contrast uh, radioactive material from the left kidney as we see here. Another cause of hydronephrosis in neonate it is megaureter as we see here unilateral enlargement of the kidney with hydronephrosis, tortuous ureter, and there is delayed excretion uh, uh, of the contrast on the affected kidney, and this is the ultrasound, and you will see the dilatation ureter, and this is a peristaltic segment of the ureter with retrograde. Another cause of hydronephrosis in the children, it is posterior urethral valve, as we see here, posterior urethral valve with bilateral reflux and hydronephrotic changes. Another patient with hydronephrosis caused by vesicular urethral reflux, as we see here in this patient. Multicystic dysplastic kidney, and as we said in the introduction, it is presented as multiple cysts on ultrasound which are not communicating with each other. And the cysts are variable in size, and this is the second most common cause of renal mass in the neonate. The condition thought to be caused by severe urethral obstruction early in the during gestation, and multicystic dysplastic kidney often occurs unilateral and does not affect renal function unless the contralateral kidney also associated and affected. And common associated anomalies of the multicystic kidney dysplastic kidney Uretropelvic obstruction in about 10 to 20%, reflux nephropathy. Here, patient with multicystic renal disease, dysplastic renal disease, see multiple cysts not communicating with each other, and the cysts are variable in size, and this can mimic hydronephrosis. Also, the left kidney is small in size with multiple small cysts. Here, another patient with multicystic dysplastic kidney disease with multiple cysts, variable in size, not communicating with each other. And the parenchyma are echogenic and dysplastic. Congenital mesoblastic nephroma, this is occurs in the neonate, and it is rare benign hamartomas renal neoplasm or benign spindle cyst, and the lesion represents 3 to 6% of renal tumor. And it is most common renal tumor accounts about 75% in the first 6 months of age. Here, this is echogenic mass in the kidney, right kidney with hypochoric areas in it, and this is proved to be congenital uh, meso mesoblastic nephroma. And here another patient with congenital mesoblastic nephroma involving the right kidney, upper mid ball. Here another patient with congenital mesoblastic nephroma of the right kidney. Autosomal recessive polycystic disease is the most common heritable cystic renal disease occurring in the infancy and childhood, and it is distinct from the autosomal dominant polycystic renal disease, which tend to occur in older population. And the clinical spectrum was widely variable, ranging from perinatal death to a milder progressive form, which may not be diagnosed until adolescence. On ultrasound, bilateral enlargement of the kidneys and the kidneys are echogenic. Here, this is fetal ultrasound with patient with enlarged kidney and autosomal polycystic renal disease. Here, this is a blame film with a patient with autosomal recessive polycystic renal disease and demonstrate bilateral flank masses in this 3 days old boy. Here, this is the IVU as we see in patient with autosomal recessive polycystic renal disease with demonstrate excretion of the contrast with enlarged both kidneys and distorted pelvic calcium system with striated nephrograms. Here, this is the ultrasound of another patient with bilateral autosomal recessive uh, polycystic renal disease in 11 hours old term male newborn, and we see uh, the kidneys are enlarged with echogenic with multiple small cysts. Here another patient with large kidney with multiple small cysts. Here this is MRI shows a large kidney with multiple small cysts. This is coronal MRI. Inversion recovery demonstrate a large kidney with big spleen and multiple small cysts associated in this patient with Caroli disease. In this patient with autosomal recessive polycystic renal disease. Renal vein thrombosis is common vascular condition in neonate in a newborn, and the predisposing factor is include prematurity, dehydration, sepsis, birth asphyxia, shock, maternal diabetes, polycythemia, cyanotic heart disease, and indwelling umbilical catheter. And patient presented with hematuria, flank pain, hypertension, and renal failure. The ultrasound shows enlarged kidney with prominent echo in the intermedullary streaks as we see here. Here, another patient with enlarged kidneys and right adrenal hemorrhage. Here, and the enlarged kidneys also shows hyperechoic intermedullary streaks, as we see here. In initial phase of renal vein thrombosis, and this represent blood or thrombosis in the interlobular and arcuate veins. Here, another patient with CT scan with uh, renal vein thrombosis on the left side with large kidney. Thank you very much for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.